Hello everyone, I am Dr. Shreyashi Chatterjee. I am a medicine specialist, diabetes and hormone specialist. Welcome to the channel. Today we are going to talk about heel pain. Many people say, "Doctor, my heel hurts badly when I get out of bed in the morning. The first step I take feels like I am stepping on something sharp. After walking for a while, the pain improves a little, but then it comes back again." If this sounds familiar, stay with me until the end of this video. Today we will discuss what is the most common cause of heel pain, who is more likely to develop it, what treatments are available, and when further testing may be needed. Let's get started. The most common cause of heel pain is a condition called plantar fasciitis. Along the bottom of your foot, there is a strong band of tissue that runs from the heel to the toes. This structure is called the plantar fascia. It helps support the arch of the foot and plays an important role when you walk, run, or stand. When repeated stress is placed on this tissue, tiny areas of damage can develop over time. Gradually, pain begins around the heel. An important point to understand is that plantar fasciitis is not always simply an inflammatory condition. In many people, it is actually related to gradual wear and degeneration of the tissue. That is one reason recovery can take time. Now let's talk about the symptoms. The most common symptom is heel pain when getting out of bed in the morning. The first few steps are often the most painful. After walking for a short period, the pain may improve. However, it can return after prolonged standing, walking, or running. Now the big question, how is it treated? First, some good news. About 80 out of every 100 people improve without surgery when appropriate treatment and self-care measures are followed. However, patience is important. Improvement often takes between 6 and 8 weeks and sometimes longer. The first step is rest. If your job requires long periods of standing, try to take regular breaks whenever possible. The second step is ice therapy. Applying an ice pack for about 15 to 20 minutes several times a day may help reduce pain. If the pain is significant, your doctor may recommend pain-relieving medications. Examples include acetaminophen or certain anti-inflammatory pain medications. Some people may also experience temporary relief from pain-relieving gels or sprays. However, medications alone do not address the underlying problem. That is why stretching exercises, proper footwear, and weight management are equally important. If you are carrying excess weight, losing weight can help reduce pressure on the heel. Now let's talk about footwear. Poorly fitting shoes or worn-out footwear can make the problem worse. Choose shoes that provide good heel support and proper arch support. Some people benefit from custom orthotics or over-the-counter insoles. Interestingly, even if the pain affects only one foot, healthcare professionals often recommend wearing insoles in both shoes. Some patients may also benefit from a night splint. A night splint gently stretches the plantar fascia and calf muscles while you sleep. This may reduce morning pain. One of the most important parts of treatment is stretching. Regular stretching of the plantar fascia, calf muscles, and Achilles tendon can be extremely helpful. A gentle foot massage before getting out of bed in the morning may also reduce discomfort. If you are a runner and your symptoms are worsening, consider temporarily reducing your running distance. During recovery, low-impact activities such as swimming, cycling, or similar exercises may be better options. If symptoms continue despite these measures, physical therapy may be recommended. In some cases, a corticosteroid injection may provide temporary relief. However, these injections are generally not given repeatedly. Most specialists avoid giving more than 3 steroid injections within a 6-month period. Shockwave therapy is another treatment that may be considered for selected patients. Only a small number of people eventually require surgery, usually after all other treatments have failed. Who is at higher risk? Excess body weight, flat feet, very high arches, jobs that require prolonged standing, suddenly increasing running or exercise intensity, poor footwear, repeated walking or running on hard surfaces, tight calf muscles, a tight Achilles tendon, weak foot muscles, differences in leg length, and the natural loss of cushioning beneath the heel that occurs with aging. Now let's discuss testing. In most cases, doctors can diagnose plantar fasciitis simply by listening to your symptoms and examining your foot. Most people do not need an MRI scan. Blood tests usually do not confirm this condition. Your doctor may check your height and weight to assess risk factors. If another condition is suspected, an X-ray may be recommended. Ultrasound can sometimes be used to measure the thickness of the plantar fascia. MRI scans and bone scans are usually reserved for selected cases where another serious condition needs to be ruled out. So, if your doctor recommends additional testing, there is usually no need to panic. Often, these tests are performed to exclude other possible causes of heel pain. To summarize, heel pain caused by plantar fasciitis is very common. The good news is that most people recover with the right combination of treatment, proper footwear, stretching exercises, weight management, and patience. If you or someone in your family is experiencing heel pain, do not ignore it. Early attention and appropriate care can make a significant difference.